The confirmed number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 20,866, with 91 additional deaths. Here in Torrance, 149 additional cases were reported, with no new deaths. Welcome to COVID-19 Today. I'm Bella Shaw. It's Thursday, January 27th. The city of Torrance topped 20,000 total COVID-19 cases on the two-year anniversary of LA County confirming its first COVID-19 case. Statewide, we are now at more than 8 million total cases. LA County marked its grim anniversary on Wednesday with 91 new deaths, including that of a 15-month-old, the youngest resident in the county to die from the virus since the pandemic began. Public health officials say this is a stark reminder that the virus can cause devastating outcomes among the most vulnerable, including young children who are not yet eligible for vaccinations. Public health officials in LA County schools are implementing various safety measures, such as school-based vaccine clinics, testing, and upgraded mask requirements. The extra effort is resulting in fewer cases among students and staff. For the week ending on January 23rd, schools conducted more than 555,000 tests and confirmed slightly less than 41,000 positive results. That's a test positivity of 7%, which was lower compared to the previous week. Despite cases going down, the number of school outbreaks went up, showing just how infectious the Omicron variant is. Between January 16th and the 22nd, there were 11 new school outbreaks. Parents are reminded that the COVID-19 vaccine is the best way to protect children from the virus. More than 15 million kids ages 5 and up have gotten their shots nationwide. 400 million free non-surgical N95 masks are on their way and are hitting local pharmacies. The Biden administration's plan is to offer the masks to help combat the Omicron surge. Authorities say each person can get up to 3 masks from major pharmacy chains and community health centers. According to the White House, the first set of masks are set to be available in Northern California as soon as today, with the program fully in place by early next month. The free masks are approved by the National Institute for Occupational Safety and Health and are being released by the Department of Health and Human Services Strategic National Stockpile. The Biden administration says this is the largest deployment of personal protective equipment in U.S. history. Many pharmacies are refusing to give a 4th dose of a COVID-19 vaccine to the immunocompromised population, despite a directive from the U.S. Centers for Disease Control and Prevention. As a result, the CDC is sending a clear message to pharmacies this week on a conference call, saying stop turning those people away. Although 4th doses are not currently recommended for the vast majority of Americans, the CDC has urged millions of people with compromised immune systems to get them. But many immunocompromised people say they're getting denied the extra dose at hospitals and pharmacies. The CDC estimates there could be close to 7 million immunocompromised Americans, including cancer patients, organ transplant recipients, and those with advanced HIV. Studies found many of these individuals did not have a full antibody response to 2 or even 3 COVID-19 vaccine shots. Moderna gave its Omicron-specific booster shot to its first study participant as a part of its Phase 2 clinical trial. Research published Wednesday in the New England Journal of Medicine found that a booster dose of the vaccine remained effective against the Omicron variant, but did show signs of waning antibody protection. CEO Stefan Bancel says while they're reassured by the antibody's effectiveness at 6 months after the booster shot, they are advancing their Omicron-specific version of the vaccine booster given the long-term threat demonstrated by Omicron's ability to evade immune responses. He added that they are also evaluating whether to include this Omicron-specific candidate in their multivalent booster program. The company expects to enroll about 600 people in the study, which will take place at up to 24 sites in the U.S. Now, some participants will already have received 2 doses of Moderna's vaccine, and some will have received a booster shot as well. This news comes on the heels of a similar announcement Pfizer and BioNTech made on Tuesday. They also began their Omicron-specific vaccine trials and plan to study the safety and tolerability of the shots in more than 1,400 Americans. Children's Hospital Los Angeles received a large grant to help better understand the long-term effects of COVID-19 among children and young adults. CHLA announced they were awarded an $8.3 million grant from the National Institutes of Health. CHLA is one of more than 30 institutions that will conduct a national study called RECOVER, which stands for Researching COVID to Enhance Recovery. Health officials hope the study will give them a better understanding of what's being called long COVID and the mystery surrounding the after effects of COVID-19 infections. Long COVID consists of a persistence of symptoms in people who've recovered from a SARS-CoV-2 infection, with symptoms including fatigue, coughing, chest tightness, breathlessness, palpitations, myalgia, and difficulty focusing. And as earlier waves of the pandemic didn't impact children as it has with the Omicron variant, the research will focus on how long COVID-19 is impacting younger patients. CHLA's principal investigator, Dr. David Warburton, says an estimated 5 to 15% of youth infected with this virus could develop long COVID. The grant will also allow researchers to study 2 other post-COVID conditions, including multi-system inflammatory syndrome in children, or MIS-C, and CVI, vaccine-associated myocarditis. CHLA is one of the few hospitals in California selected to take part in this study. Another study finds that 2/3 of people with Omicron already had COVID-19 at one point. A study funded by the United Kingdom government found that Omicron has almost completely replaced the previous dominant Delta variant in England, with the majority of the cases being possible reinfections. The Imperial College London's REACT study analyzed more than 100,000 PCR test results from across England, with swabs collected between January 5th and the 20th. The study found 99% of sequenced positive swabs came from people who were infected with the Omicron variant, with only 1% of infections caused by the Delta variant. Now, previously, health officials believed having COVID-19 brought some layer of protection from reinfection, but that doesn't seem to be the case with the Omicron variant. The U.S. health officials estimated in December the risk of reinfection with Omicron was 5.4 times greater than with the Delta variant. But there is some good news from the research team in England. Getting a COVID-19 vaccine remains the best defense against getting sick. As COVID-19 cases hit unprecedented numbers nationwide in recent weeks, many workers felt a growing pressure to keep going to work while sick. According to a study from Texas State University, there was an increase in presenteeism, or the act of showing up for work without really being productive, when there is no structural support for employees taking time off. Dr. Elizabeth Eager says it's difficult for individuals who don't have paid sick leave or are required to get a COVID-19 test to get tested and not miss work. Her study showed people had to go to work while sick before they knew if they were COVID positive, because employers would not let them call out. Another reason some COVID positive people kept going to work was because of the pressure they got from their employers. Some told their employees to not miss work because of short staffing. One employee at a fast food restaurant in California filed a complaint with the Sacramento County's Public Health Department after her employer, who knew she may have COVID-19, told her, quote, "Don't worry, everyone has it. You can still work. Just wear a mask and don't tell anyone." Dr. Eager says the U.S. Centers for Disease and Control and Prevention reducing the isolation time for people who test positive became another contributing factor for employees to go to work while still sick. She says now, even if someone has a positive test, once they are fever-free, they are encouraged to go back to work with a mask. She hopes her research will be a part of creating newer and healthier practices for workers in the U.S. and says we need to challenge these norms because they can put us and others around us in danger. The California Department of Motor Vehicles is expanding its digital services in an effort to reduce carbon footprint. Customers can now opt to get things like renewal notices by email instead of mail, or even renew their vehicle registration online. Renewal notifications are typically mailed out 2 months before registration expires, but those signing up for digital services this month could get access to renewal notices for car registration with expiration dates as late as May. To sign up for paperless vehicle registration and driver's license renewal notices, create an account online at dmv.ca.gov. We all know exercise is good for your health, right? But a new study found that even as little as 10 minutes a day could be life-saving. According to a study published in the peer-reviewed Journal of American Medical Association, more than 100,000 U.S. deaths could be prevented each year if adults over 40 added just 10 minutes of moderate to vigorous physical activity to their normal routine. Adding 20 or 30 minutes more could save even more lives. The author of the study, Pedro Saint-Maurice, is an epidemiologist at the National Cancer Institute. He says the study provides additional evidence of the benefits of exercise for adults over 40. They looked at data which included activity levels of nearly 5,000 participants between the ages of 40 and 85 and tracked their death rates. Saint-Maurice says while the study doesn't focus on the benefits of exercise for individuals, it reinforces the fact that we can make our nation healthier by encouraging everyone to add an additional 10 minutes of activity or more each day. Grocery shopping will get more expensive, especially if you're a fan of sandwich meats, hot dogs, and cheese. Kraft Heinz says it will raise prices in March on dozens of products. The increases range from 6.6% on 12-ounce Velveeta fresh packs to 30% on a 3-pack of Oscar Mayer turkey bacon. Most cold cuts and beef hot dogs will go up about 10%, coffee around 5%, and some Kool-Aid and Capri Sun drink packs by about 20%. The company told its wholesale customers that inflation continues to dramatically impact the economy. Kraft Heinz is the latest consumer manufacturer to announce plans to boost prices this month. Last week, Procter & Gamble shared similar news, saying it will raise prices for its retail customers by an average of 8% next month on Tide and Gain laundry detergents, Downy fabric softener, and Bounce dryer sheets. Conagra, which makes Slim Jim, Marie Callender's, and Bird's Eye food products, also said it will raise prices later this year. U.S. consumer prices already went up 7% annually in December, the steepest climb in 30 years. The annual Greater Los Angeles homeless count has been postponed due to the Omicron surge. It typically takes place over 3 days and 3 nights in the month of January, but it's been pushed back a month and will now take place from February 22nd to the 24th. For the past few years, the city of Torrance has served as a deployment site and partners with the LA Homeless Services Authority, local municipalities, law enforcement, and community members. This year, the count is taking place on Wednesday, February 23rd at the Ken Miller Recreation Center. The homeless population and the data collected help organizations advocate for the unhoused and allocated resources needed to help everyone experiencing homelessness. You do not need any prior experience to volunteer. Due to the pandemic, volunteers are limited to 2 to 3 individuals from the same household. Those under the age of 18 must volunteer with a parent or guardian. Families can register together at theycount.org/Torrance_count_2022-0126. Now, if you have any questions about the registration process or to confirm your registration status, contact Nancy Wilcox at nancywilcox777@gmail.com. Well, as we head into the weekend, be sure to tune in to Weekends in Torrance. New episodes air at a special time this weekend due to the extended replay of this week's council meeting. So be sure to mark your calendars to catch Weekends in Torrance beginning at 4 p.m. tomorrow, Saturday, and Sunday. On Friday, tune in to hear tips on which face masks will offer the most protection during this ever-changing pandemic, what to look for when purchasing masks to ensure they're authentic, and how to properly wear them to continue to stay safe. Then on Saturday, we'll introduce you to one of the city's public works heroes dedicated to keeping the city clean. And on Sunday, we'll take you inside Plane Tag's Moto Art in Torrance to show you how they're taking retired planes and creating one-of-a-kind collectible art, aviation tags, mementos, and gifts. These stories and much more will air this weekend starting at 4 p.m. You can find us on Spectrum Cable Channel 3 Verizon Fios Channel 31, streaming on our website as well as on YouTube. Well, before we go at the end of each program, we like to share feel-good stories from our community. Pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. A couple of Torrance residents donated beautiful flowers to Seaside Heroes Park. Jenna Christensen, who leads a monthly beautification event there, picked up 20 lantanas to add to dozens of flowers donated by a neighbor. She says city crews planted the donated flowers this week and hope they will bloom and add more color to the community space they love by spring. What a sweet way to show how Torrance truly cares. Now, if you have a great story, an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. Have a great weekend, and we'll see you back here on Monday as Leslie Robbins brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.